Let us see the difference between thrombocytopenia and thrombasthenia. Thrombasthenia and thrombocytopenia are both a condition affecting platelet function and blood clotting, but they differ in their underlying cause and characteristics. As you know, thrombocytopenia is characterized by a low platelet count, while thrombasthenia, specifically Glanzmann thrombasthenia, is a condition where platelets are present. They are normal in number, but their function is impaired due to genetic defect. So thrombocytopenia is a low platelet count, whereas thrombasthenia is non-functional platelets, decreased platelet function. Thrombocytopenia is decreased platelet count. Thrombasthenia is decreased platelet function. Thrombocytopenia is a condition characterized by a low platelet count in the blood, leading to increased risk of bleeding. Platelets, also known as thrombocytes, are crucial for blood clotting, and the low levels can result in easy bruising and bleeding. Thrombocytopenia means having platelet count below the normal range, which is generally considered to be between 150 to 450,000. Platelets are essential for forming blood clots to stop bleeding after an injury. When platelet levels are low and the body's ability to blood clot is impaired, leading to increased risk of bleeding, bruising, or other complications. Thrombocytopenia can be caused by various factors, including bone marrow disorders, certain medications, infectious, autoimmune disease like ITP, and malignancy. The symptoms of thrombocytopenia include easy bruising, epistaxis, heavy menstrual periods, bleeding from mouth, rectum, or other parts of the body. The severity of thrombocytopenia can vary based on the number of platelet count.
Thrombocytopenia is a condition where the patient has an abnormally low amount of platelets in the blood. The normal range for platelets is between 150,000 and 450,000, and these are stored in the bone marrow and about one-third are stored in the spleen. The function of a platelet is clot formation to stop bleeding, so patients with thrombocytopenia are at increased risk of bleeding. Thrombocytopenia can be caused either by impaired platelet production, such as a viral infection like HIV or hepatitis, folate or B12 deficiencies, or aplastic anemia where the bone marrow doesn't produce enough red blood cells. It can also be due to increased platelet destruction, like in DIC or heparin-induced thrombocytopenia, which is an immune response that can occur in patients receiving heparin, and it can also be due to impaired platelet distribution, such as liver cirrhosis or splenomegaly. Symptoms you can expect to see here are all due to prolonged clotting, so things like easily bruising, bleeding from the gums, nose, or mouth, oozing from IV sites, prolonged bleeding times, and petechiae or purpura, which are the scattered red-brown or purple dots on the skin that indicate bleeding. Let me know if you'd like a part 2 and check out the full study sheet in the Nursing School Success Fund.
Thrombasthenia, especially Glanzmann thrombasthenia, is an inherited bleeding disorder where platelets are present but cannot function properly to form a blood clot. It is caused by a genetic defect in the integrin protein, which is necessary for platelet to bind to fibrinogen and aggregate to form a plug. In the case of thrombasthenia, platelets cannot properly aggregate and form clots due to the lack of fibrinogen bridge. Individuals with thrombasthenia may experience mucocutaneous bleeding, which can include bruising, nose bleeding, bleeding gums, and heavy menstrual periods. Prolonged bleeding, including bruising, nosebleeds, gum bleeding, and heavy menstrual bleeding, is the consequence. Glanzmann thrombasthenia is the most common type of thrombasthenia. It has subtypes based on the extent of the deficiency or dysfunction of this protein. Thrombasthenia is diagnosed based on history of prolonged bleeding, a prolonged bleeding time, and inability of platelets to aggregate in response to various stimuli. Management focuses on preventing bleeding and managing symptoms, which might include desmopressin, local hemostatic procedures, platelet transfusion, and the recombinant factor 7. So, the most common cause of thrombasthenia is Glanzmann thrombasthenia. It's a bleeding disorder that is characterized by prolonged or spontaneous bleeding, which is caused by lack of protein that is normally present on the surface of platelets. The condition is congenital, which means it is present from birth as autosomal recessive disorder. Platelet transfusion is the standard treatment for severe bleeding. It is a lifelong condition and there is no cure. Patients should take special steps to try to avoid bleeding. So, as a summary, thrombasthenia or thrombopathy is a functional defect, whereas thrombocytopenia is a platelet count decrement or decrease in a number in platelet count. Thrombocytopenia can be caused by sequestration, production, utilization, destruction. Production decreased, utilization increased, and the destruction, which can be immune or non-immune. Thrombocytosis increased platelet concentration, which can be physiological or excitement and reactive. This is a summary of the difference between thrombasthenia and the thrombocytopenia. Thank you for watching.